All right. Well, Dr. Gary here. We just jumped on the line unplanned. You got off your shift at the old clinic. What's going on over there?
Uh, it's just it's just a bunch of stuff that doesn't make sense, and it's really infuriating as someone who is not only a doctor taking care of people, but also a small business owner, employing people, and like we have responsibilities to take care of people and keep our society going, and the current state of affairs, what's today? For reference, for when
The
people are
first,
listening, it's
December
December
1st.
1st. December 1st. And so the COVID positive rates keep going up, right? And that's all we hear about. And then there's all this fear mongering about people, shutting down businesses, creating more restrictions. And it's like, when it's so frustrating because this is how this is a perspective from someone who's in the middle of not just the patient care, but the business side of things. On the patient care side, you have people that are scared and confused. You have increasing numbers of people coming in with disastrous mental health situations. People, frankly, there's people that are just given up. They've accepted depression and anxiety and feeling nervous and not sleeping as their new normal, not just wearing masks and staying home. It's very frustrating to me when you go on any news source and the only thing you hear, or you follow doctors, and the only thing they say is, stay home, wear a mask, and avoid people, basically. And it's then, the numbers keep going up, and people aren't listening. People are just doing whatever they want. No, that's not true. That is a fake story. The reality is people are listening, and the infection continues to spread. As we expected, as an infection like this spreads, it's what it does. And in our hospitals, we're getting better at taking care of the patients. The death rates are going down. The intensivists are getting better at managing the infection without putting people on ventilators, et cetera, et cetera. So why is this so frustrating? Because as we head into the holiday season, or we're in the middle of it, and as people are trying to get their lives back and their livelihoods, especially in the entertainment industry or the restaurant industry here in Los Angeles, to see the news and our politicians fearmonger these test results is despicable. It is embarrassing, and history will look back on time badly, to say the least, horribly. I think that we are misstepping so many times, and we continue to misstep, and we continue to lie and be unprepared. What does that mean? So, if you've listened to our COVID episode, we talk a lot about the other things you can do. So yes, there's 3 things that everyone recommends, but there's many other things you can do to build your immunity, build your resilience, and be prepared. There's also the reality that if you're not sick and you're young, less than 50 or less than 65, really, that the death rate and even the hospitalization rate is astronomically low. So with all that, and then you see these really great studies coming out about vitamin D and how powerful vitamin D is, and that why aren't we talking about vitamin D when the vitamin D deficiency can account for many of these deaths. And we don't think about vitamin D for a number of reasons that we're not going to get into here, but me and Brian have intentions to have another podcast where we really dive into this. What happens is businesses like mine, many other urgent cares, medical practices, all medical facilities, and other businesses that need to go back to service, figured out, okay, well, if we test people, we spend money. It's not cheap. The government and the insurance companies are not paying for these tests. These are companies going out of their pocket, out of their budgets, or individuals going out of their pocket and budgets to pay for these tests. You will, of course, see more effing positive results. That's what happens when you do more tests. So when I hear today that, California has 7,000 new positives, well, because everyone here is industrious, and we're working hard to have some semblance of normalcy, to have some business, to create some opportunity, right?
Mm-hmm.
People, you can't just shut down the economy indefinitely. Even in a communist nation, that's not reasonable and possible. So what I'm trying to get at is, when you watch the progression of this thing and people start adapting by doing testing, and you continue to spit a false narrative about increased tests means increased prevalence. No, it's not. It's here. It's like here. We're just testing more. The death rate's going down. Yes, there's more deaths. Well, we're in the winter flu season. This is what happens during the flu season. Oh, and by the way, it's not just the flu that kills people during this season. People are at home more. They have vitamin D deficiencies. They're more susceptible to any infection, like any infection, a bacterial infection, any common virus that also takes people's lives. Then you add to that the holidays, and people are more liberal with their diet. They're drinking more. They're having more good times, which means that they get sick more. That's what happens when you have heart failure and other diseases. You get sick when you eat more shit and do all the stuff that we do during this time of year. So there's a million reasons why people are going to the hospital, why people are getting sick. And we also have a brand new virus that people are seeing and having a hard time with, their immune systems are having a hard time with. So we don't shut down everything. That's not what you do. There's great evidence from around the world that smarter people than myself have analyzed on various podcasts that show that lockdowns don't do anything. There's a lot of evidence to suggest that we are taking the wrong approach. So what I wanted to kind of share is this like insider perspective that you cannot expect any businesses to stay in business. You cannot expect anyone to find any happiness or sense of normalcy. And no, this isn't a world war. And no, this isn't the infection from outbreak that kills like 70% of people or 33% of the population. No, that's not what we're dealing with. Why are we acting like that? Why are we fear-mongering? Why are we destroying everything about our society and crippling businesses, industries? For what? I think it's very clear now that the treatment or the cure is worse than the disease. And we're not going to get into vaccinations, but that is not going to be an easy process. Nor do we know that they're going to absolutely reduce the number of deaths, because that's not how vaccines are looked at. It's not always looking at absolute deaths. Again, not for this conversation, but we can definitely talk about it, or we can. But you cannot take away everyone's livelihood. You cannot shut down industries that drive our society and our nation and expect a good outcome. You cannot use Western medicine practices of looking at healthcare myopically, using limited data that is sexy to talk about and scare people with, without creating an education platform and delivering the nuance of what these numbers mean. And I think that what we're seeing is an undermining of our society. And again, not for this podcast, but there's a lot of people that have all sorts of ideas about the Great Reset and all, like what you might consider a conspiracy theory. But it's not about why. I cannot explain why, but it is very, very clear, abundantly, overwhelmingly clear that by shutting everything down and taking people's livelihoods away, you are not helping, you are hurting. And in fact, you are irreversibly destroying our society. And maybe 6 months ago, I was afraid to say something like this, but I think people need to hear it. I think people need to hear it from that people need to listen to doctors that are not just in the hospital. Hospital medicine and academic medicine is a very, very small percentage of healthcare in America. It drives the behaviors because it drives recommendations, and that's what we look to the ivory towers and the academic institutions to kind of guide us. But the vast majority of healthcare, and I don't want to throw numbers out, but it's like very, very high, like more than 80% of healthcare is delivered in the private sector, in private clinics and by private companies. And even your big health insurers are private companies ultimately. Even your big HMO, IPA companies are private companies. And everyone is drowning and suffering. And for what? And I don't understand what fantasy people are living in. We have good testing. We have strategies to protect ourselves. We have the reality that this infection is out in the world and it's not going anywhere, and you're not going to outrun it, and you're not going to slow things down. It's not going to happen. We don't have overrun hospitals. That is fear mongering. That's not true. Every year that I worked in residency and every year that I worked in the hospital around this time, we had days where we would have to close our hospital and defer patients from our hospital to other hospitals, because that's how it works. Every year around the holidays, people get very, very sick. There's something called holiday heart. There's a lot of disease processes related to this time of year. So nothing we're seeing is surprising. Nothing we're seeing is undermining our healthcare system any more than we have already done so by making a terrible, terrible system. Mm-hmm. And to now destroy industries and private businesses
and lives
is despicable. And I know that other people are out there thinking about this and feeling the effects. I also know that there's people out there whose loved ones have died from this. I also know other people with loved ones who've died from heart disease and dementia and pneumonia and a million other maladies during this time. And that's all sad. But we do not get to destroy our society because of some numbers. Just like I don't treat numbers. I don't treat someone's LDL. I don't treat someone's systolic blood pressure. I treat the patient. I assess them for what disease processes are going on and what interventions make sense. Some people need drugs. Other people need lifestyle changes. Other people need both. Some people listen. Some people don't. That's how life is. You cannot shut everything down because you are wrong about your recommendations. I want people to know, honestly, that that healthcare providers and companies are out there. They're not trying to make a buck. They're trying to create avenues for people to get back to life. And when you see these restaurants building outdoor facilities and investing tons of money into that, they're paying out of their business's pocket. When you see companies testing all of their employees on a weekly or bi-weekly basis so that everyone can feel safe, they're paying for that out of their pocket. No one's paying for that. The lab companies need to make money. The companies that generate the tests need to. We live in a capitalistic world. By taking on draconian principles, shutting things down, telling people to isolate and be afraid when they can activate and build themselves and build their communities and lean on each other, driving people into fear of one another. I see it every day. It's destroying us. It's destroying us at our core. My patients are suffering. It doesn't matter how rich or poor you are, even though it increasingly affects poor people who can't have the resources to wiggle out of this thing. But it's catching up to small business owners. A lot of people who have very successful businesses, it's not like they have a year of free money like that they can pull out of their account. Like, no, a successful business runs on operating expenses, money coming in, money going out. So you cannot shut down our society over this. Again, if the death rate was terrible, if we thought that something can really be done to stop it in its tracks, but we know it can't. We know it can't. It's like the school's fucking closing down. You can't just close down the schools because the numbers of positive rates go up. Those positive rates are multifactorial, more testing, the season. There's a bunch of factors. Now the evidence comes out that children can't really pass it that well from each other into family members. So now they're going back, and Fauci and the CDC talking about how, well, we shouldn't have closed schools. This is embarrassing. It's embarrassing that people are sitting around scared, watching CNN, just scared. And it's not okay. That those media platforms have a responsibility to deliver meaningful information and not just a bunch of fear. I'm disgusted. I am disgusted with our leadership, our government leadership, our journalism. No more journalists. That's not a thing anymore. Just a bunch of clickbaiters. And I want to hear more doctors speak up. And if you're a doctor that speaks up and says, wear a mask, stay home, and keep 6 foot apart, you're not bringing anything meaningful to the conversation. We've already heard that recommendation. We know. We're doing it. It's not working. You can't shut everything down. So what are you going to do? Why don't you give some meaningful recommendations? Why don't you read about vitamin D? Why don't you open your mind about different lifestyle practices? I'm all over the place.
That was a top Dr. Gary rant right there. I'm so on the same page as you. I'm so glad that a doctor is willing to speak up. I don't really hear much from these doctors because they're scared. Maybe they think they're gonna, I don't know, have these ramifications from government officials. They could lose their license. Like, who knows what people can do. So I'm glad that you're speaking up, because we need to do something at some point. We have a friend that's saying, what are you doing? Or, I was talking to a girl from Canada who, was around last weekend. She said, what are you doing? You're just sitting here. You guys got to stand up for your rights. You got to do something. You can't just sit here and let the government just tell you what to do. So, and people are listening. So I'll tell you, I traveled over Thanksgiving. I didn't let the government tell me what to do. But you were right. In the beginning, you said people are staying home. They are listening to it. They are. LAX was empty. LAX was a insane ghost town. I've traveled every Thanksgiving because I'm not from here, right? I have to visit family. My family's gone because of the terrible medical and diet advice. So I travel with friends on Thanksgiving, and I've traveled every Thanksgiving. And I had to walk home twice, not home. I had to walk out of LAX twice. I had to get my suitcase and walk out. It was so busy. And this lines, just hour lines to try to get into LAX. This time, not a single person. This just empty. Went to the international terminal. The only people were international people who, maybe they don't listen to the same rules. And they were all fine. Everyone's good. Got on an airplane. People taking off their masks, drinking water, having snacks. I don't get how we're not having these insane stories of, oh my God, this airplane, everyone was, it's a mesh network. Basically a mesh network, right? It means that I'm 3 feet from everyone. Because I'm 3 feet from 6 people, then we're all basically connected, right? We're all passing along. Maybe they're like, oh, we have some better filtration in the airplanes. It's not going to do anything. If this was that crazy, then we would have heard about it in the airplanes. We would have heard about it in the grocery store workers that been working this whole time. We would have been hearing about it with the Uber drivers that have been going. I don't know. I don't even know what I'm saying, but okay, I will use some science, because right now I'm just making up random stories and anecdotes. There's a study in the New England Journal of Medicine that I just read about. Zero coverage on it. This article even covered the coverage of it. Mm-hmm. And the study showed thousands of military recruits, right? These are the people that they're in boot camp. They follow everything to the T. They will get kicked out if they don't do exactly what they're told. The study goes through all the things they had to do. They had all the rules. You had sanitize everything between this. They split up 2 groups, thousands of different military recruits. And they had the most insane procedures I've ever heard. After 14 days, the group with all the testing and all the precautions and all that had a 2.8% PCR positive. The non-participants, the control group, had 1.7. they had less. I mean, it's pretty small. It's maybe not statistically that significant between 2.9 and 1.7, but the group that didn't do all the precautions and didn't have all the testing and didn't have all the quarantining, if there was a positive, had lower positive results. This is a study, New England Journal of Medicine, November 11th. The
Just came
headlines,
out.
there's only 4 headlines. So this article is the Economic Research Institute, American Institute for Economic Research, AIER.org. CNN, many military COVID-19 cases are asymptomatic, studies show. That was their result from this. ABC, broad study of Marine recruits shows limits of COVID-19 symptom screening. Like, that doesn't even tell you what the results were. That is a misleading headline. So out of all these outlets that could have covered this, no one talked about the actual results. And there was just 4 that said meaningless headlines about small things that didn't matter. So like you were saying, if you can do all these measures, you can do all this, it doesn't matter because it spreads. If it spreads, it spreads. If it doesn't, if it's not going to spread, it's not going to spread.
Look, there's so many examples like this of research that is providing us meaningful interventions and meaningful ideas about what we can and can't do. And it's being ignored. It's just being ignored. Can I mention 2 studies that I recently came across? This came out, I think, just recently.
Well, here, I want to do one more.
Do one more. Yeah.
Is the one out of Japan that showed the deaths from suicide outnumbered the 10 months of COVID deaths.
Oh, we're talking about the Japan study. I was about to bring it up. So I know the numbers. So Japan was thought of as doing a really good job. Japan has a society where they kind of stay away from each other and are like distant anyway. It's kind of their culture. And so they're well adapted for something like this, but yet they still increase their isolation. And so you would imagine a place like that where they're already used to that, they're going to be good at it and they're going to be extra scared. And that's what they did. So they had some of the best death numbers, and they only in their whole country had 2,000 deaths. In that same time, in this last year, they had 17,000 suicides. So one thing you should know is in Japan, they have a suicide problem. It's, again, part of the side effect of a not relatable, sort of difficult culture. I don't want to use difficult, but a culture that separates people and creates more distance and less interpersonal relationships. And there's a lot of issues in Japan when it comes to sexuality and a low birth rate because of their issues with sex and their sort of cultural relationship with all that. So they already had a high suicide rate, and they track their suicide rate really closely. That's why we have this study to begin with. So they're a prime example of a country that was set up to do really well with COVID, but also set up to do really badly with our management of COVID. So they saved lives from their lifestyle and they're following the isolation rules, and they cost many, many lives in a way that, at least in my mind, infection's a part of life. Suicide should not be, not in those kind of numbers. So I think it really is a great example of this idea that the treatment is worse than the disease.
Yeah.
It's like a perfect example of that. And they are, another, you can look to Sweden as someone who didn't follow. And here you could look at a country that did follow these guidelines. And because of their already established issues with suicide, it's amplified. And what we will see, and I can't give you that evidence yet, but it's going to come in the next decade, we're going to see a crazy increase in our suicide rate. We're going to see a crazy increase in our diagnoses and exacerbations of anxiety, depression, mental disease. We're going to see a crazy increase in people diagnosed with dementia. We're going to see people more and more dying from nursing homes and hospitals who are isolated and don't get to be with people. We're going to see the morbidity and mortality of this thing, especially in a mental health perspective, unfold. And it will be too late then to have this conversation.
Yeah.
Not that anyone cares about our conversation except for the people listening, but I'm just saying, like, it's happening, you see it, and you have to act on it.
This is what I was thinking about. Maybe this is part of why this is happening. This can explain some of this stuff. You have these politicians, right? And they need to look good, right? They're going to say, "Hey, this is what we did. We did all we can. We are the heroes. We're saving lives." And no one's going to see this stuff 10 years down the road, or 3 years down the road. They showed that they did all these things and they're the heroes, and no one's going to have to see the body bags otherwise. I think that's a big part of it, is right, because if you can just act like you're the hero in the moment and do all that you can, say that, oh, we're following the science and we did this and we did that, and no one's going to see all the repercussions later, and then you could just write those off in other ways, then you look good. Because what else can you do? Look bad. You can look bad otherwise, and you would
It's
get.
just like the story about food. All these people for decades and decades gave bad recommendations, and they can't admit that they're wrong. And that's why we have Sapien, and that's why we have Food Lies, and that's why we have a voice, because we're now able to stand up for it. And while we are not politically charged company, we're neither me or Brian are very political at all. COVID is we're treating it in a similar way. And what we're seeing is the same kind of mistakes that were made with bad recommendations on food, guidelines put out before there were meaningful data. And the ramifications are a worse outcome than if you had done nothing at all. I already know that if they didn't put out those guidelines based on terrible epidemiological evidence for low-fat diets and that BS, that we wouldn't have the disease epidemic we have. We would have some checks and balances on fast food and processing, right? Because by the time they made recommendations, they'd see the evidence and they'd see that, oh shit, sugar and diabetes is the problem, and we really need to get ahead of this. So they'd start taxing companies, but instead they put out shitty recommendations. Companies got super powerful, like McDonald's, like Coke, like all of these food companies. And now, good luck trying to change the recommendations. Good luck trying to do something meaningful. There's a lot of money at stake. So you can't, you said something about, follow the science. I am sick of hearing from my colleagues that the science is out. We know how to treat COVID. We know how to manage COVID. Stay home, wear a mask. The science is not fucking out on that, okay? Maybe it does something. That's what the science says. Maybe it does something. Maybe. Not for sure.
There's other tests that show otherwise, but
not for sure.
Yeah.
We know that masks were disproven as a good way of protecting against coronaviruses just a few years before coronavirus. Pull that reference for you. They've done the studies. They knew about viruses before corona. So then you do an observational study where you show people sneezing into a mask, and there's a bunch of other BS studies because you can't do a randomized placebo-controlled study in a month while this is going on. So no, the science is not out on masks. The science is not out on isolation. The science is not out on just today, the CDC is saying, we're going to decrease the quarantine period to 7 days from 14 days. That's a crazy, crazy change, you guys. People are miserable at home for 2 weeks, losing money, losing their livelihood. When for what? The science was out. So the science was out that it was 14 days last month, and the science is out now that it's 7 days this month. Give me a break, everyone. Use your brains. Recommendations are guidelines. They're guidelines. Use your brain. And treating Americans like they're retarded and they don't listen to you and they're not capable of following orders, and the only way to get them to do it is to make the orders more aggressive and more oppressive, that's called communism, fascism, dictatorship. It's horror. Whatever, though, those are loaded words, but I'm telling you right now, the way our government is behaving is destructive. The way my colleagues are standing by and saying, yes, sir, that's right. I'm going to tell everyone to do what you said, is destructive. You are doing more harm than good because you're not using your own brain. You're a scientist. You have the highest level medical degree. You have the highest level degree. Expect more from yourself. Go come up with a novel idea and share that with people. Fuck. Please don't get mad at me. I don't mean to be upsetting to
This
everyone,
is this
but
is
it's
great, man.
true. I just
Yeah, yeah.
can't.
No,
I just
I
can't.
know. I don't want to go on forever and belabor this, but
Yeah, I gotta
it's
go anyway.
it's really disappointing, and I don't know. I don't know how to spin this in a positive way to
I
go
got to
out on.
spin. If you want to help your family members, if you have a sick older loved one suffering from obesity and diabetes, or if you're 30 or 40 and you're 20 pounds overweight and your doctor's talking about hypertension, go download the Sapien podcast.
Mhm.
Go download the Peak Human podcast. Go buy our program that we spent at so much energy developing, not to make money, to teach people how to live and be healthy. So if you want to do something meaningful other than stay home, wash your hands, put on a mask, adopt a Sapien lifestyle and diet, and you will be more prepared for everything that comes your way.
When it comes your way, that's why that's why I feel safe traveling. That's why, I mean, I don't interact with any older people. I don't know what, yeah, I don't have any, risk factor. Sorry.
My fiance is laughing at me because I'm yelling at the top of my lungs in my
I
house.
love it. I love it. So I'll just say, by living this way, I don't get sick anymore, and I'll go on a plane, and I'm not gonna be scared. And so far, so good. And if I get it, then I get it, and I can't hide from it, and I'm ready for it. So live the Sapien lifestyle. Go to sapien.org. That's all we have to say. Let's wrap this up and come back next week.
Love you guys.